Olumiant is a selective immunosuppressant, active ingredient Baricitinib. Indications: treatment of moderate to severe active rheumatoid arthritis in adult patients who are intolerant to or fail to respond adequately to treatment with one or more DMARDs. Olumiant can be used as monotherapy or in combination with methotrexate. How to use. The decision to prescribe Olumiant should be made by a physician experienced in the treatment of patients with rheumatoid arthritis. Olumiant should be taken once a day at any time, with or without food. The recommended dose of Olumiant is 4 mg once daily. A dose of 2 mg once daily is appropriate for patients aged 75 years and older, and may also be used in patients with history of chronic or recurrent infection. The administration of the drug at a dose of 2 mg once a day can be considered in patients who have achieved stable control of disease activity after the use of the drug at a dose of 4 mg once a day, and for whom a dose reduction can be recommended. In patients with creatinine clearance from 30 to 60 ml per minute, the recommended dose of the drug is 2 mg once a day. Olumiant is not recommended for use in patients with creatinine clearance less than 30 ml per minute. In patients with mild or moderate hepatic insufficiency, dose adjustment is not required. Olumiant is not recommended for use in patients with severe hepatic impairment. Contraindications: hypersensitivity to the active substance or to any excipients of the drug, pregnancy, breastfeeding period, children under 18 years of age, due to lack of data on efficacy and safety. Special instructions: the incidence of infections, particularly upper respiratory tract infection, is higher with baricitinib than with placebo. In previously untreated patients, the combination with methotrexate showed an increase in the incidence of infections compared with baricitinib monotherapy. In the event of an infection, careful monitoring of the patient's condition should be ensured, and if the patient does not respond to standard therapy, it is recommended to temporarily stop the use of the drug Olumiant. Side effects: infections and invasions, very often infections of the upper respiratory tract, often shingles, herpes simplex, gastroenteritis, urinary tract infection, from the hemopoietic system, often thrombocytosis, infrequently neutropenia, from the site of metabolism, very often hypercholesterolemia, from the digestive system, often nausea, on the part of the skin and some cutaneous tissues, infrequently acne, and increase in body weight.